Imagine waking up one morning in so much pain you can't move. Not only can you not move, you can't eat on your own, breathe on your own. Better yet, you have lost the ability to do anything on your own. Each breath you take is agonizing, not only for you, but for your family. There's no medicine or surgery that can help relieve your pain. What would you do? Euthanasia has been around for centuries, although it is illegal in most places. Merriam-Webster's dictionary defines euthanasia as the act of killing or permitting the death of hopelessly sick or injured individuals in a relatively painless manner for reasons of mercy. Euthanasia is a controversial subject due to the fact that it involves the issue pertaining to life. Those people who oppose euthanasia believe it is a form of murder, and employing it would devalue human life. On the other hand, those who are pro-euthanasia believe the right to die should be a fundamental right of each person. The case of Diane Pretty illustrates the suffering many patients are forced to endure after being diagnosed with an incurable disease. Diane Pretty was diagnosed with motor neuron disease and faced a painful death in which she wanted to avoid. She was quoted from her website saying, "I want to have a quick death without suffering, at home, surrounded by my family." She appealed unsuccessfully to the UK and then the European Court of Human Rights to allow her husband to help her die. BBC News interviewed Deborah Annetz, who is a director of Voluntary Euthanasia Society. Deborah stated, "Starving to death is a difficult thing to do. For Diane, it would have taken 10 days. She did have tremendous strength of purpose. She saw her fight not as a struggle. If she had been in France, Sweden, or Denmark, she would have had a right to assisted suicide. In the UK, she does not. The last week was very distressing. The only way she could be made comfortable was with massive pain relief. She died in a coma. All she wanted was a dignified death." Motor neuron disease completely destroys your motor neurons, eventually causing complete paralysis. Diane was not able to move around without a wheelchair. She lost her capacity for decipherable speech, and the only way she could be fed was through a feeding tube. Diane ultimately died suffering without any assistance. Forcing someone to endure severe pain and torment when they wish not to be is devaluing human life. When a person can no longer think, speak, or act for themselves, they are being stripped of their dignity. Another argument that is made is that doctors have the moral responsibility to keep patients alive. But technically, a form of euthanasia already exists in the case of a DNR. A DNR is a legal document a person signs stating they do not wish to be resuscitated if their breathing or heart stops by any medical personnel. Would you consider a physician who doesn't attempt to save a patient in cardiac arrest as assisted suicide? Euthanasia can also be characterized by failing to attempt life-saving techniques. Allowing a patient in cardiac arrest to pass in death without attempting to revive them is therefore a form of euthanasia. Rosamond Rhodes, a PhD and director of the bioethics education at Mount Sinai School of Medicine, stated, "A doctor's commitment to acting for patients creates a clear obligation to help a patient avoid an agonizing, protracted death. Allowing a patient to suffer when the suffering could be ended is an obvious violation of duty of beneficence, sometimes because of special features of the need, or because of the special relationship, or because of the uniqueness of knowledge involved. A physician may be a professional obligation to assist in a suicide or perform a euthanasia." Medical care is very expensive, especially for the terminally ill. A patient must pay for x-rays, medication, and medical staff. In fact, according to Richard Meyer, last year, Medicare paid $55 billion just for doctor and hospital bills during the last 2 months of the patients' lives. and it has been estimated that 20 to 30% of these medical expenses may have had no meaningful impact. On the other hand, the International Task Force on Euthanasia and Assisted Suicide wrote, savings to the government could become a consideration. Drugs for assisted suicide cost about $35 to $45, making them far less expensive than providing medical care. This could fill the void from cutbacks for treatment and care with the treatment of death. Money used to treat a patient who wants to die can be used instead on a person who can be saved. Medical costs can also have a negative effect on a patient's estate. Medical costs can eat into that estate, leaving the patient unable to leave their children and grandchildren with anything when they die. Not only that, but when a person doesn't have enough money in their estate to cover medical bills, the insurance has to take its loss and pass the cost on to another family member. It's unethical to force someone to use their own money when they wish to no longer receive treatment. Suicide is also an issue in the elderly. Many people believe teenagers are most likely to commit suicide, when in fact, this is a false statement. This graph was produced by the National Center for Injury Prevention and Control. It illustrates how much suicide rates increase in the elderly compared to other age groups, especially in males. This is the suicide rate for the elderly. Rainbow Access is a nonprofit organization who was granted money from the New York State Department of Health to conduct research on suicide. They stated, the elderly are most at risk for committing suicide. Youth ages 15 to 24 are in a high-risk pool, but actually, the elderly are at the highest risk for committing suicide, as elderly adults have suicide rates close to 50% higher than all other age groups. There are several factors that might influence these statistics, including social isolation, loneliness, depression, finances, and the death of a loved one. Chronic severe pain, disease, and the diagnosis of a terminal illness may also increase suicide in the elderly. In the book entitled Suicide Across the Lifespan, Premature Exits, several studies were conducted on the correlation between elderly suicide and terminal illness. David Lester has pointed out that many elderly suicides are medically ill and often in chronic pain at the time they kill themselves. Miller found that 60% of elderly suicides visit physicians within 1 month prior to taking their lives. A study by Dorpé, Anderson, and Ripley found that 85% of elderly suicides were all ill at the time of their death. Not only that, the manner in which the elderly commit suicide is often painful and traumatic. According to the American Association of Suicidology, firearms were the most common means used for completing suicide among the elderly. Men use firearms far more often than women. If someone wants to end their life, nothing is going to stop them. In that case, we should provide a method in which death is peaceful while also allowing the family to say their goodbyes. Medical science has made it possible to keep the body alive by using life support equipment, but these patients aren't actually participating in real life. A patient shouldn't have to endure constant pain and confinement to a bed when they desire otherwise. I don't believe in the right to kill a human being, but I do think it's acceptable to allow someone to die at the end of his or her life without pain and without suffering.